So we have with us the School of Nursing graduate nursing students from Dr. Chavez Child Health Practicum that will be sharing information today about asthma for our youth. And I will turn it over to Dr. Chavez and let him and the students introduce themselves.
Hi, welcome and thank you for joining us again this week. So as Dr. Horton mentioned, my name is Eduardo Chavez and I'm a professor of child health at the University of Texas at Austin School of Nursing. And joining me today is a group of our fabulous graduate students at the School of Nursing. And so I will kind of let them go around and just to quickly introduce themselves, and then we'll turn it over to our presenters.
Hey guys, I'm Abby.
I'm Lindsay.
I'm Ryan.
Kayla.
Gail.
I'm Kavya.
And I'm Alexandra.
I'm Christina.
All right, so just a quick reminder before we get started, our presentation will last about 20 minutes, and then we will turn it over and answer any questions that you may have. So without further ado, I will turn it over to our two presenters.
Great. I'm Sandra, and I'm going to start us off. Cool. So today our presentation is about asthma. So we're going to talk a little bit about how to grow up with asthma. So our objectives today are to learn what asthma is, to learn what makes it worse or triggers for asthma. We're going to figure out how to make do with asthma in your daily life, and then also talk about famous people that have asthma. So what is asthma and how do you get it? Basically, it affects the lungs. It makes it hard to breathe. And some people might not know this, but sometimes you actually grow out of it. Experts are actually unsure of how you may get it. It's probably a mixture of environment and genes. And then you can't catch it from other people. So we have a quick video just on basically what it looks like in your body when you have an asthma attack.
An asthma attack happens when you're exposed to an allergen or some other trigger, like a virus, cold air, exercise, stress, or environmental pollutant. Your airways become inflamed and swollen, and the muscles in your chest tighten. Your breathing tubes become narrow and make extra mucus, making it hard to get enough air into your lungs. Your airways start to overreact, causing spasms that lead to wheezing and coughing. A severe asthma attack can cause shortness of breath and a tight feeling in your chest. Your skin may pull in slightly between your ribs. You may have hunched shoulders and strained abdominal and neck muscles. Your face and lips may have a blue tint. And you may feel confused, agitated, or unable to concentrate. A severe asthma attack can be life-threatening. If your symptoms aren't improving with home treatment, see a doctor right away.
All right, so that's basically what happens in your body. And they spoke a little bit about triggers. So some of those are exercise, and that's one of the major triggers that I think a lot of people associate with asthma. But we also have allergens that can trigger it if you have pets, if there's pollen in the air, which is huge for Austin. And there's actually a really cool website that you can look at. And this is a local news station that has basically the allergy report for the day. So today, grass is one of the major allergens, and then we have all of these other allergens that are on the lower side. But you know, if you feel like you're experiencing symptoms, you can take a look and see if you know there's a certain allergen that's higher for the day, and be able to gauge what your triggers might be. So that's a really handy website. We also have pollution, which can be smoke or even perfume smells, something as simple as that. Also having a cold or the flu can trigger an asthma attack, and cold air or hot air, it just really varies person to person what your triggers might be. So living with asthma, basically you want to figure out what your triggers are, and then avoid those. And you know, see your doctor and take any kind of prescribed medications that your doctor suggests. And some of those might be quick relief inhalers like albuterol, or pills that you can take every day to prevent asthma attacks from happening, which are a little bit more of a longer term control. And then it's never a bad idea to get your flu shot, just to make sure that you have some extra protection against that when the season comes around, to avoid having an asthma attack triggered by that. So we have a little video about how to use an inhaler.
Using a metered dose inhaler with a spacer. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Put the inhaler mouthpiece into the end of the spacer. Inhale a deep breath and breathe out all the way. Hold the inhaler and spacer between your pointer finger and thumb. Put the mouthpiece of the spacer in your mouth and above your tongue. Close your lips around the spacer. Tilt your head back a little bit. Press down on the inhaler one time and breathe in slowly and deeply. Breathe in all of the air you can and hold for 5 to 10 seconds. Open your mouth and breathe out slowly.
All right. Oops, sorry.
I need to stress out.
Okay, let me figure out how to get this to full screen again. Oh, here we go. There we go. Okay, so I think that the major point of this is basically the use of a spacer. So the spacer is basically just a tube that allows the medication to get aerosolized, or basically broken up into tiny little particles so that it can get into your lungs more fully than just using the inhaler itself. So if anyone was wondering what that's for, that is what that is for.
All right, thanks, Sandra. My name's Gil. I'm going to be talking about that kind of like the growing up with asthma part. Sandra went over like how you get it, what it looks like, but now more how it could affect your day-to-day life. So first we're going to talk about smoking and asthma. So I think we all know smoking is bad for you in general, even if you don't have asthma, but it makes it worse if you do have asthma, right? Because all that smoke is getting into your lungs, and it can actually damage your lungs for the rest of your life. So then it's going to make it hard for you to play sports, and then just get better. So if you have asthma, and even if you're taking your daily medication, if you are around smoke, it's going to affect you, and then you might see that your asthma is not
in years.
And the big thing is, even if you yourself don't smoke, but you're around people who do smoke, so secondhand smoke, it can trigger your asthma attacks or any flare-ups. So I would say the biggest thing is to make sure, one, that you don't smoke yourself, and then talk to your family, talk to your friends, and make sure they're not smoking around you. And this also includes like e-cigarettes and vaping, because that is all damaging to your airway and your lungs. Okay, and the second thing, sports and asthma. So a lot of people might think that just because you have asthma, you can't play sports because it takes a lot of effort, like you breathe more and stuff like that. But actually, if it's well controlled, you can do anything. It's just important to be more diligent, and then make sure you have any emergency medication with you in case you do have asthma attacks. So basically, like, just being prepared. And these are just some tips that I found in playing sports or just any type of exercise or physical activities. So you want to start with about a 15-minute warm-up, just so like get your breathing regulated and get your lungs warmed up. And then at the end, you want to end with a 15-minute cool down. And then it's recommended, if it's cold outside, to wear some kind of covering on your face that covers your nose and your mouth. So then that when the air hits your lungs, it's warmer than if you just go outside without something on your face. And then it's also important to avoid those triggers that Sandra talked about. So for example, my brother, growing up, he had asthma and he was really allergic to grass. So for him, he couldn't really play sports that were in the grass. So for example, soccer. So for him, it was better to play something like basketball that was just played on like concrete or a blacktop. So that's important to think about. And then I think a good point is, even if you don't want to play any sports, it's important to get some physical activity, some kind of exercise, because that will improve your asthma. And I'm sure if you talk to your doctor, they'll tell you everyone should be doing physical activity and participating in some kind of exercise, but it's just going to make your lungs stronger and overall lung function greater. And then again, just follow your doctor's orders and use medications like they talked about. So if you had to take an inhaler before you're doing any physical activity, or, you know, long-term, your daily medication, just talk to your doctors and your coaches and stuff like that. And then school and asthma, I think the big thing is everyone should know that you have asthma. So then, like, they know you have asthma, what to do about it. So like, for example, my brother on the first day of school, he'd always take his doctor's note to tell the teachers. Eventually he would tell his friends, because if they were all playing outside and something happened to him, then the friends would know to go call a teacher or the nurse. The nurse should know the medications you take. Even if you carry your own medication, for example, if you had an inhaler in your backpack, they should know, just in case they need it if you are having an attack. And then the last thing is having an asthma action plan. So in the next slide, this is kind of an example of one. So basically it's just a written plan, and you come up with it with your doctor or your family, and then you give it to anyone that needs it. So like if you're in daycare, your coach, a nurse, and basically it's a plan of what to do for your asthma. And you have different sections. So like depending on how you're feeling, you know what to do. So you have your green section here, which is like your daily regimen, just like you're feeling good, but like this is the stuff you need. So if you're on a daily medication or a daily inhaler, this is where you would write it down, and you're feeling good. There's signs and symptoms here, right? Like your breathing is good, there's no coughing, there's no wheezing. So that like you are doing well and your asthma is controlled. And then the next step is like the yellow step. So basically you're starting to feel, maybe you're coughing, maybe you have a cold, you're starting to feel a little bit of chest tightness. So again, like your doctor comes with a plan, like what to do. Like it might include an emergency inhaler, it might include other medications. And then lastly, the danger zone, the red part right here, is if it's really bad, full-blown asthma attack, you can't speak, you can't breathe, like what to do in that case. And then for everyone, it's going to look different, because again, like everyone has different triggers, everyone has different severity, but that's why it's important that everyone has their unique action plan. So then everyone basically can be on the same page. Everyone knows how to treat it, and then you can get it under control before it gets really bad. And then we just want to include a fun little slide here of famous people we found that hopefully you guys know who have asthma, just to show, like, you know, like David Beckham is a famous soccer player, and he's made it big time, you know, and his asthma is well controlled. Harry Styles, One Direction, musician, and then Eminem, he's a rapper, you know, he has to rap really fast, so he has good lung function and capacity. All these people are doing really well, so just to show like people have asthma and you can get through it and still live a normal life. Okay, now we have a fun little quiz. I know it's kind of hard on Zoom, but if you think you know the answer, you just want to unmute yourself and say the answer, then we can do it that way. So the first question is, when people have asthma, their airway can be overly sensitive to A, exercise, B, dust, C, cigarette smoke, D, all above. Does anyone know?
So let me hear from any of our Mount Zion youth. You can unmute yourself and take a guess.
I would say the answer is D.
Yeah, that's right. Good job. Yeah, so all these are kind of like the triggers that we talk about that can make it hard, like flare up your asthma.
Okay, so we have some true and false questions, and if you feel like you know the answer, just shout it out. So we have, okay, smells from perfume, cosmetics, cleaning solutions, and paint and gasoline can trigger asthma symptoms. What do y'all think?
True. Maybe true.
Yep, so that one's true. And then exercise-induced asthma usually means the end of participating in sports.
False.
Awesome. That one is false. As we just saw in the last slide, David Beckham has it. So weather can trigger asthma symptoms.
True. It's true.
Awesome. And then asthma can cause lung infections. What do y'all think? This one we didn't really go over too much, so. So this one is actually false, which is good. And laughing and crying can sometimes trigger an asthma flare-up.
Is that true?
That is true. Good job.
Okay, we have two more questions, and these are kind of harder because they're more about how you treat asthma. So this one, asthma treated in two ways. A, with antihistamines and air purifiers. B, by building resistance to triggers and keeping the house clean. C, by avoiding potential triggers and with medications. Or D, with nebulizer or drugs. What do y'all think? All right, the answer is C, by avoiding the potential triggers and with medication. Yeah, we talked about it a little bit, but this is the best way. Just so you want to know what triggers your asthma, and you do that by going to the doctor, figuring out if you're allergic to anything, or when you start to feel bad, and then like with the medications they give you to treat those symptoms. And then the last question, again, kind of tough. People with asthma might need two kinds of medications. A, nasal decongestants to minimize mucus and antihistamines to control allergic reactions. B, quick relief or fast-acting medications to stop symptoms and long-term medications to prevent symptoms. C, pills and liquids. D, coughing and stuff for allergies. What do y'all think?
I think it's A.
You think it's A? Okay. Good guess. The answer is actually B. We mentioned a little bit. So you want to, if you say you are having a little bit of shortness of breath right after you're playing a sport, you want to maybe take your inhaler, so that quick relief, fast-acting medications to stop that symptom, but then also long-term medications. Maybe you're taking something every day to help you. The first one would be good. if you are feeling sick, but I would say the second one is more if you feel like your asthma attacks are bothering you right now. A good guess. These are just references where we got our information, and yeah, I think we did good on time. Do you guys have any questions or comments or anything?
So what questions do we have from our Mount Zion family?
It's me, Tisha. So Jansen is 19, and through high school, he didn't really have any flare-ups at all. So you mentioned that sometimes you outgrow the asthma, but what precautionary measures should we take? Because in the normal world, we were planning to send him off to college this fall, and I didn't know what we needed to do to prepare for that. I mean, obviously that's probably not going to happen, but in the future, what measures do we need to take? His doctor is a pediatrician. It was for the pediatric years, so we need to find a new doctor first of all for his age. Well, like today, he's out mowing the grass with my husband, but that usually is not a trigger. For me, it kills my allergies. But for him, that's not a trigger. It's usually when the weather changes, going from hot to cold. We go through boxes of Kleenex then. So back to my original question, what precautions do we need to take now? Because it seems like nothing has happened, and he doesn't even know where his inhaler is because he hasn't needed it.
Yeah, so my brother actually, he kind of outgrew his asthma, but he still goes to the doctor every year, and he gets a refill on his emergency inhaler. Because sometimes, like, I think it's kind of similar when the weather changes, like he will feel like something like allergies, and like if he tries to go on a run, like it'll affect his asthma. So I think it's important to like still have like an emergency inhaler just in case something happens. So yeah, you just go, I guess, like if you guys are finding a new doctor, I think that'd be a good thing to have a prescription for and have that filled and have it with him so he can access that. And then, yeah, I think just watching the trigger. So if he knows the weather's going to change, like, does he take anything now? Like any kind of like Zyrtec or Benadryl or anything if he's feeling?
Yes, he takes a daily Singular.
Yeah.
And that was another thing. The doctor had him stop last summer and not take it, and he was fine, but I'm just thinking, okay, once you stop, then I'm thinking it's gonna recur and flare up. So I had him to start taking it again, well, especially when last fall, because the changing of the weather, he was getting really congested.
Yeah, that's a good point. So maybe talking to the doctor again and asking, like, can I take this when the weather changes, or like what are some other kind of medications to take? Because I know like my brother, he'll start taking Zyrtec when he feels like the weather's changing, or he feels like his allergies are flaring up. But again, like just talking to your doctor and making sure like what are some medicines that that they can take if they start to feel like their allergies or asthma is flaring up.
Okay. Thank you.
I take Singular just for my allergies. I don't have asthma at all. So it is something that you can take even if you don't have asthma. I don't think it's a bad thing to be precautionary like that and have him take that just in case.
Okay. Thank you.
Yeah, good question. Anyone else?
The only thing I would add, Tisho, is I think, as you mentioned, the important place to start would be to get reestablished with a healthcare provider close to where he's at. That would be able to help him and manage if he did begin to have symptoms again. And I think you also mentioned that allergens weren't really an issue, but just kind of maybe being familiar with what different allergens he may encounter where he's going. Right. In case he was to have symptoms, then we'd begin to reinvestigate what triggers are, because they may be different triggers there than they are here, because right. This body is used to a lot of the pollens and and things that are in the air here, but maybe not there. So.
Okay, thank you.
Any other questions? Okay. If you could do me a favor before I make announcements, if our Mount Zion family could please thank our graduate nursing students for taking time to share with us about asthma.
Thank you.
Thank you.
Thank you.
Thank you.
Next Thursday, we'll meet again at 3 p.m. via Zoom, the same link. And if I'm not mistaken, we're covering, is it cancer next week? Or what are we doing next week?
Lung disease.
I believe it's lung disease.
Lung disease. So we have lung disease next Thursday, and then the last Thursday is cancer, correct? Okay, so if you have questions that you would like to submit in advance, you can email those to Reverend Horton, and he can forward them to Dr. Chavez to get to the students. And if for some reason you might be shy, at the bottom of your screen, there's a chat box. So you can also type questions in the chat box if you ever decide you'd prefer to type it out than speak. So I want to thank our youth for being an amazing audience, and thank you again, School of Nursing, and everybody else can sign off. Y'all have a blessed one.
You too.
Thank you so much for having us.
Bye, guys.
Bye.
Bye.
Bye, Josh.